We have a lot of circumstances where we do very, very long operations here, very complicated operations here. And having worked with Dr. Parker so long, I've gotten to know him, his likes, his needs, his patient's wants, his patient's needs, that we do a lot of our communication non-verbally when it comes to the medicine and the care that we provide here. We know each other's habits very well. I know his habits very well. I know the needs of the particular procedures that he's doing after having done them many, many times with him. Well, Dr. Parker usually has had much more interaction with the patients prior to my coming and visiting the patients, and very often the patient will express some concerns regarding the anesthesia, which he'll then relay to me. We do discuss the procedure at hand and whether he intends to vary from his normal procedure. When in the case where we have patients having multiple procedures done, it's very important that we discuss the sequence in which we're going to do them, because that can drastically affect the anesthesia that I give and positioning of certain monitors, intravenous lines, that type of thing. Sometimes we have to be a little bit creative when we're doing kind of awkward combinations of procedures at one time, and we kind of have to put our heads together and kind of think our way through it, especially with sequencing, which is going to be the better one to do first, which is going to be the better one to do second, etc. We maintain the same level or even a higher level than we maintain in any hospital anywhere in the United States. We are required by law to have a certain set of monitors. We do use certain monitors in addition to the ones required by law. It's a fully equipped operating room environment in terms of giving anesthesiology. Statistically, studies have shown that postoperative nausea and vomiting can be as high as 85 or 90%. We go to great pains to try to prevent that. In the 14 years I've worked with Dr. Parker, he has always encouraged us to give an anesthetic like we would to any one of our family members. He's never ever asked us to constrain ourselves in terms of the equipment that we use, in terms of the medications that we use. He wants us to provide the safest and most comfortable experience for his patients that we possibly can. For an anesthesiologist, that's a wonderful environment to work with, and certainly much different than the environment we work in hospitals very often, where we do have constraints of time and equipment and pharmaceutical monies we can spend on a particular case. In cases done under general anesthesia, we almost always have the patient awake within 5 minutes after the termination of the procedure by Dr. Parker. We do keep patients, depending upon the length of the procedure, for at least an hour, and after the procedure, for more complex and longer procedures, we do routinely keep patients overnight in the center with an RN at their bedside for the entire duration. There are several. Probably the first one is that anesthesiologists are these people who bring people very near death and bring them back. And that has always bothered me, that that's the general public's conception of anesthesia. It is not nearly that dangerous a thing to do. In fact, general anesthesia is extremely, extremely safe, especially with the safety mechanisms that we have in place in a well-equipped center like the Parker Center. It is by no means that dangerous an undertaking. We take a lot of care to make sure that we don't put the patient in any danger whatsoever. That's why we're very thorough about history taking, reviewing laboratory results, getting medical consultation prior to surgical procedures as necessary. We don't like to ride the edge here. We like to keep ourselves a very, very broad safety margin, and indeed we do. It is a very, very safe undertaking.